Hello, everyone. Welcome in. My name is Drew Bailey. This is Clinical Confidence Rounds. We're going to get started here very shortly. I know that we are now at that 12:30 Eastern time mark, and we're going to go ahead and get started. Bear with me here as I am going to learn about how to share my screen from YouTube, and it looks like I found it. So what we're going to be doing is going over a GI map of a 74-year-old gentleman, and we're going to be talking through what that care plan is going to be looking like. So if this is your first time here, my name is Drue. I'm one of the clinical advisors here at Functional Medicine Academy, and this is our weekly clinical confidence rounds. And what we do is go through an advanced test, a case, and also explain a little bit more about how to actually go through when it comes to making interventions and navigating the treatment process for this patient from a functional standpoint. Now, the reason why we do this is because functional medicine can be very difficult when it comes to first getting started. We come from whatever a medical background is, and it can be a little difficult to really find that good treatment protocol and to get patients really great outcomes. And so today, what we're going to be doing is explaining our thinking and our rationale behind some of the interventions that we are making, how to read an advanced test, and what other different types of clinical considerations we do want to make when it comes to supporting these types of patients. As always, if you have any questions, please feel free to drop them in the chat. I can see them, and I will also get them. And please give me some recommendations as far as any advanced test or any type of patient case that you would like to see. Oh, hi, Trish. Thank you for coming in. It's great to see you. I see people coming in. I'm not able to see your names unless you type in the chat, but if you are here with me and you can hear me okay, go ahead and say hello. I'd love to see who is watching, and please, I'd love to hear your questions. Oh, Jessica, wonderful. Okay, I'm so glad that this is working because I was a little worried. It's my first time going live on YouTube. I just started figuring out this whole process, and so I'm glad that we are live and ready to go. Welcome in, both of you guys. All right, well, let's go ahead and get started here. I'm going to share my screen, and I am going to show the GI map here. This is a redacted case that was sent in by one of our practitioners. I'm actually going to... Oh, yep, we can see it. Awesome. Wonderful. Let me see here. Oh, great. Okay, we are all good to go then. So I want to see, how familiar are you guys with the GI map and with this advanced test that we have right here? Let me make sure I can see your guys' chat here. Have you run newbie here? Okay, Trish, welcome in. You're in the right spot. We are going to be going over this test. This is one of my favorite. There's a lot of gut tests out there, and a lot of them are really great. I like the, oh, great. Awesome. Jessica, you've done two. Well, that's great. You're already moving up when it comes to utilizing that GI map. So wonderful, but still feel like a newbie. Great. Well, you're in the right place. I know when it comes to functional medicine, it can be very overwhelming, right? Because the GI map is a very comprehensive test, and we really want to go through the different aspects of it, and really when it is indicated, when we might want to choose a different test. But the reason why I like this one the best... Oh, okay, wonderful, Trish. Well, we'd love to see more of you. I'm so glad that you have been in some of our classes. This is essentially kind of like a clinical consult class, except we're really going to have a lot more of that breakdown when it comes to this single test, rather than having a little bit of a limited time to get through multiple cases. And so please, there's no dumb questions. If you have any questions, please let me know. I remember being a new functional medicine practitioner, and I asked all the questions, and that's what really helped me learn. So I can see all your questions in there, but let's go ahead and talk a little bit about this GI map test first, and then we will get into the GI effects. I am a lot more Zoomer, but this is the one I'm most familiar with, and I think I highly recommend just choosing tests. Like, you don't have to get a different stool test. I highly recommend just finding a test that you really want to learn about, and just really get good at one test at a time, like one stool test at a time, I'm going to say. So that way it's not overwhelming as far as, oh my gosh, like I have to get this stool test and this stool test. I have to learn all the stool tests. No, I'm the one most familiar with it. I order this for most of my patients and I get really great results with it. I think it's really comprehensive. So, with that being said, let's go ahead and get started. The GI map, what we have broken down is we have our pathogens. And what I actually like to explain when it comes to patients is if your patient is struggling with bloating, constipation, diarrhea, belly pain, maybe gastric reflux, any of like those digestive type of symptoms, this is a great test to order. And a lot of times, if your patient into their GI doctor or their PCP and they request a stool test, they would most likely only run this first page. And as you can see, it's very helpful because you have a Campylobacter, you have our C. diff toxins right here, E. coli, Salmonella, Giardia. We have like, our major, more red flag pathogens that we can see. But as we go through the rest of this test, we can see how we're just barely scratching the surface to really find out some of those underlying things that we really can look at and optimize when it comes to this patient's health. So yeah, we have our pathogens, and you can see here we have Campylobacter that's present. And there's a really great guide that I like to use, and I highly recommend here. I could drop it in the chat. This is a guide I highly recommend taking a look at. I think I can put it in the chat. Yay, awesome. This is the GI Map Interpretive Guide. I use this a lot when I was just starting out because it gives you a breakdown of each one of the markers and just some treatment considerations based off of the markers that you might be seeing that are high or out of that optimal range. All right, so let's move on. We also have some H. pylori that's present. We also have our keystone bacteria. These are all of our good gut bacteria. And of course, we want those all to be in the green, ideally, and we don't want them to be under or we don't want them to be over because that comes with a whole host of other types of symptoms. We also have H. pylori present. We are at risk deficiencies like folate, B12. A lot of our animal-based proteins, of course, are really calcium is really digested in the stomach, and so when it comes to H. pylori being present, that can put us at risk for not getting the nutrient absorption that we need to, specifically at that stomach level. And it can also put people at risk for like acid reflux and other different types, especially if these virulence factors, these are all negative, but sometimes if these are positive, it could put your patient at risk for like gastric ulcers or even types of stomach cancers as well, based off of how intense that virulence factor is. You could take a look at the link that I just put in the chat is a really good resource. So you could take a look. I don't have them all by memory, but of course, a good practitioner, you don't have to memorize everything, but you have to know where to find the answer. And so this is a good resource that I always have in the back pocket to go through when it comes to different treatment plans or come across a marker that I'm not as familiar with. All right, so this keystone bacteria here, it all looks decently good. We do have a little bit of that Escherichia that's missing, or it's a little on the lower side. But overall, I would say this is a decently good commensal bacterial balance. I've definitely seen a lot worse, but we definitely could use some work because we have a couple of keystones that they're in the green, but they're close to the range. So we really want to make sure that we're diversifying the diet, adding in a lot of good fibers, resistant starches to help with that microbial diversity. We are just vessels. We are just vessels, and in return, they give us short chain fatty acids, which help support the environment within the gut, lower inflammation levels, and prevent us from being at risk for like colon cancers, polyps, and other different types of gastrointestinal diseases. So we want those, but we want to feed them in an appropriate way. So good fibers when it comes to their diet is going to be really important to create that diversity. We then go to this next page, which can show us like our opportunity or overgrowth microbes. Now, it's very common to see some of these be present, and some of them are high. Like you can see, the streptococcus is high on this person. But I always like to explain this as the microbiome is like a dense rainforest, right? Where it's not going to be perfect, where we're not going to see any, overgrowth at all. It's normal to of growth within some of these, but you want to combine, if it's like a high level like the streptococcus, combine it with the patient's like symptoms, as well as what they're presenting with, what their goal is, and also what we're seeing on the rest of the test. So I don't really like to look at markers in isolation. I like to look at the whole test and identify patterns. And that's something that we do teach a lot in our lab consult classes. If you've ever joined in there, if you're in the program, we'd love to see you in classes. But if you're not in the program, I'd highly recommend checking us out. We have or a program called Clinical Core Monthly, and it's just the clinical support. So you have me, Anna, and Lori, which are the clinical team, all of the teachers there, and walking you through the personalization of these types of tests, helping you develop treatment plans. All right, moving down, we can see here that there's no fungi or yeast present, no viruses, no parasites, which is very helpful to know. And this is one of my favorite pages, because we can see kind of how these other things that we're seeing on the upper pages are contributing to the overall health of the digestive system. We can see how well maybe the pancreas is breaking down foods. This could be pancreatic, or it could also be due to that H. pylori that we saw up at the top. We have the beta glucuronidase, which contributes to the recirculation of estrogen within our body. We have our secretory IgA, our immune response, and our at the tissue level, antigliadin, eosinophil activation protein, eosinophils at the cellular level, um, our calprotectin, and our zonulin. So within this particular patient, we're not seeing a whole bunch of red flags, but we do see that secretory IgA is low. This is I will share information about this patient, and then what some of the things that we can do to help support him. But this is somebody who, whenever I see something low like this, the body doesn't really have that immune response to take care of some of the overgrowth that we're seeing here, like the streptococcus, or also this Campylobacter and this Giardia. So we can see that because he has some of those overgrowths and some of those pathogens that are present, it's contributing to what we're seeing here when it comes to our immune response. And his immune response right now is not fortified enough to really address those issues or address those infections by themselves. And so this would be a big part of our treatment protocol, is to make sure that we're supporting his immune system, so that way we can eradicate and help the body red flags that we're seeing here. It's overall the biggest pattern that I'm seeing here on this test is we have some presence of pathogens, and we don't have the immune system to fight them off. And we also this patient also has risk of low gut bacteria. And so we want to make sure that we are diversifying his diet, making sure that his healthy microbiome is fortified enough. So that way, if we do have more pathogens or more of that presence, those are going to be enough to just really crowd it out. And we don't have to rely as much on the immune response. All right, so now that's our GI map. That's all the results here. If anybody has any questions, please again throw them in the chat. Let's go ahead and go through the recommendations and also protocol from what we're seeing on this test. And all 55 pounds, and are avoid risk of future, reduce the risk of AFib and aflutter. And so it looks like he's not really actively any give me a second. Hopefully everybody could still hear me. Let me know if you can still hear me in the chat. It looks like it's saying that my connection is unstable. Okay, good. Okay, I don't have it anymore, so let's continue going on. So it looks like this patient is really just interested in preventing long-term risk. Like he's not having any active like GI complaints like, diarrhea or constipation. It keeps buffering. Okay, thank you for letting me know. If it keeps doing that, let me know. I am at a hotel, and so I want to make sure the Wi-Fi is still good. It looks like it's stable more now, but if not, keep me updated and we'll figure out something else. But what we can see here is, yes, so we have this patient. Let me read a little bit of his health history. He had the AFib and A flutter. He also had electrolyte imbalances. He has also had SIBO causing, or sorry, I said SIBO, but a small bowel obstruction causing 7 hospitalizations in the past. And so, with that small bowel obstruction, of course, we really, really want to make sure that his diet is very diverse. He's getting a lot of fibers, that motility is still supported. So that way, we're not, going to be for something like that in the future. All right. So let's talk about, as I want to make sure that we're good on time here. And also take into account his treatment plan and any questions that you guys have. But what we really want to do is here, let me know in the chat, what would you really focus a lot of your treatment protocol around? If we were to choose some of these markers here, what would we really focus a lot more? I shared about it at the beginning when I shared the underlying pattern that I'm seeing and what really needs to be supported. If you're thinking his immune system, then that is going to be the correct answer, because we really, really want to make sure that with his history of small bowel obstructions, we definitely want to make sure daily bowel movements are happening. But we also, yeah, Trish, you got it. Improve the immune system, 100%. Great job. That is going to be our first priority, because we see that we have the true pathogens and the Campylobacter, the H. pylori, and we have some overgrown streptococcus, and so that what we're at risk for is those pathogens really going to increase inflammation levels. It could put him at risk for dysbiosis, fatigue, electrolyte instability. The colon, of course, that's where we have a lot of our electrolyte exchange. And so we're giving him at risk for that. And he already has a history of electrolyte imbalance. And so addressing that is going to be really, really, really important. The next priority is going to be his digestive capacity. I know we didn't really talk a lot about it, but his elastase is only 265. This is something, it's in the yellow, it's almost onto the red. We don't know if it's due to a true pancreatic insufficiency or if it's due to the H. pylori. This test doesn't really differentiate between the two, but we really want to pull that when it comes to our support, especially if his bowel movements are irregular or he's struggling with constipation, supporting his digestion. And so we can pull in digestive enzymes, plant enzymes. We want to avoid HCl or betaine when the H. pylori is this red or this high, because that could damaging to the stomach lining. So doing something like plant enzymes is going to be very helpful to help him digest and absorb all the nutrients that he's getting from his foods. That's going to be really important. All right, well, let's talk about some goals here. So we have an idea of some of the things and some of the process that we don't want to support. We obviously have this. Now, this is when it comes to the most challenging part, in my opinion, that I had to learn about in functional medicine is prioritizing and phasing out a plan, because we have an idea of what to do, but do we start with a kill protocol? Do we really want to improve immune system function first? Do we want to just implement a lot of lifestyle strategies? What do we do first to really help support and prepare this patient to help this patient reach his goals, right? And so what I always like to do is follow the framework as far as stabilization, reducing or clearing out, and then rebuilding and optimizing. Because if the body is unstable, for example, if eating is very irregular or he's not eating enough food, maybe a really poor diet, standard American diet, whatever it might be, poor sleep, a lot of stress, maybe not really moving that much. Those are things that we really want to address first when it comes to his lifestyle, because the reason why, and think of it as if a body is unstable, it's not safe. And for the body to heal, you really need to develop a sense of safety. And what does that mean for the body? The safety follows stability. And once you stabilize things, healing will start to happen. So we can pull in like before we talk about supplements, what we could want to do is focus on what are those things that really are going to provide that stability. Eating those stable meals 3 times a day, getting enough protein, especially because of his age. Make sure he has a lot of good protein in him. We want to make sure he's sleeping okay, because that's of course recovery. We also want to make sure maybe he's not doing high intensity crazy workouts, but at least he's moving his body, like walking every single day, getting some steps in. And then we can then, as far as lifestyle wise, then support when it comes to pulling in a lot of support when it comes to digestion. Digestion is one of those stabilization aspects or stabilization priorities. Supporting digestion and also bowel movements, that's always going to be a big part of phase one stability, and that's going to be a big goal of that phase one. And so that way it really reduces the overwhelm as far as, okay, we have to, start all these supplements right now. We have to get rid of this Campylobacter right now. It really helps us phase out a plan so that way we don't have to be worried about so many things to do at once. And so part of that phase one, it looks a little different for everybody, but what I'd like to pull in is like a magnesium glycinate for nervous system stability, really helping with that recovery, maybe even electrolyte powder to really make sure that he's getting all of those nutrients that he needs, especially with his history of electrolyte imbalances. We could also do zinc carnosine is one of my favorite yeah, to use for heal lining itself. Really huge immune support supplement as well. So pulling in zinc carnosine specifically is going to be very important for this patient. And alongside with the digestive enzymes without betaine HCl. This is where I usually also recommend like putting a patient on a multivitamin. If they don't have a good multivitamin, making a good recommendation can be helpful for those foundations. And typically it depends on the patient, but this is going to last at phase one about, about 1 to 2 months. We don't necessarily need to stay here too long, but some of the things that we really want to see happening as the body starts to stabilize is energy get a lot better, bowel movements being more regular or day. We want to see a better resilience to stress. So those are some of our like KPIs or key performance indicators that we're really looking for when it comes to supporting somebody's stability. All right, then we're going to move into phase two, which is really going to be supporting. Sorry, there's one more thing that I forgot to mention. I put it in my notes, but his immune system. So his SIG-A with this low SIG-A right here, something that we do need to support as far as that stabilization is we need that immune system to be ready to fight off those pathogens when it's time to kill them off, right? And so adding in some IgGI Shield or some SBI Protect from Orthomolecular, those are great options to really support this person's immune system as we're working on healing and stabilizing. And so then that's going to really get us ready for phase two. And again, phase two, before we get into that, we want things to be stable, bowel movements happening regularly. Then we can do a eradication protocol. This is what we typically call our kill protocol. This is where practitioners often get it wrong, where some people might normally just jump into a kill protocol, like, oh my gosh, like we're seeing Campylobacter, we have H. pylori, we need to kill this off, we need to eradicate it. And even though that is true, we really want to make sure that we are, again, stabilizing before we're clearing, or else this patient is just going to feel miserable. Because when you're going through a kill protocol, if you haven't led somebody through it before, it can be a very intensive process, and it's a lot of hand holding, because bacteria, they're not going to go off, they're not going to go out without a fight. And so they're going to produce a lot of endotoxins, because whenever you kill a bacteria, it's going to spill its little organs and poop everywhere. It's going to spill its contents out, and that's going to be highly inflammatory to the body. And so stabilizing first is going to be important to help the body clear and support that process. And they need to poop every single day or have a daily bowel movement, so that way they can get rid of all that dead bacteria, because that's essentially what a bowel movement is. It's just the dead bacteria. All right, so we're going to reduce it clear. And so you can use different kill agents, quote unquote, or antimicrobials. I typically recommend doing gram negatives like berberine, oil of oregano. You could do neem. It definitely depends on the pathogen that you see. I like to reference that guide that I put in the chats just a little while ago, the diagnostic solution GI map interpretive guide. So you can see the quality of the bacteria and what it responds best when it comes to the eradication. So throughout that time, you're going to want to keep them on a immune support supplement, because obviously that's when you're killing things off. And then we can move into that rebuild and optimize. This is where we really start to expand that microbiome diversity, normalize that, again, still normalizing the stools. We want to support that anti-inflammatory cardiometabolic pattern. I know he has that EFib, so we really just could look on, again, optimizing for those future visits. And again, just take into account like his overall goals. Like, let's say this is a gentleman who he doesn't really have a lot of muscle on him, and we know that, of course, sarcopenia is big in our elderly community. And so building up a plan to help when it comes to building muscle, improving his protein, diversifying his diet. This is where we can also talk about a probiotic, getting a good probiotic, because after we change the environment of the gut and kill off some of the bad gut bacteria, some of this good gut bacteria takes a little bit of a hit as well. Not as much as antibiotics by any means, but we still want to make sure we're rebuilding his diversity and choosing a good probiotic for this phase. Yeah, and so the probiotics depends on depends on the person. So some probiotics you want to avoid, like histamine containing strains like your lactobacilluses. I really like the spore-based probiotics or the bacillus bifidobacterium blends. That's another conversation for another time. But those are some options for that third phase. Even like a Saccharomyces boulardii is like a healthy bacterial yeast. It's not a bacteria, it's a yeast, and that can be very helpful when it comes to just supporting that long-term resilience. All right, everyone. Well, let me go ahead and I'm going to stop my screen share here. And yay. Okay, well, that was our clinical confidence rounds. I hope you had a good time. Does anybody have any questions at all? And I'm going to see if I can find the... if you are not in our program yet, we would love to have you in our community. Oh, thank you so much, Trish. It was wonderful to have you in. If you are not in our community yet, we'd love to have you in. We basically do this 4 days a week, and it's one of my favorite classes to go through these cases. And if you're in our program, please feel free to submit cases, even if you're just like, I have this test, but I don't really know where to start, or I don't have a test for my patient yet, and I really want to know what those next steps are going to be. It's a really good place for anybody to get and learn, get a better understanding about functional medicine and learn a little bit more about the whole process. So It was wonderful. Thank you so much for coming in. This is going to be the new live spot every single week on Thursday. It's going to be held in YouTube. So I will put the link every single day in the Facebook group so that way, or every single Thursday in the Facebook group so that way you have it accessible, but you can save this link and we'll see you guys next week. All right, everyone, have a great rest of the day. Bye-bye.